This is myself, Dr. Anis Fatima. I have done my BHMS and MD in Pediatrics, and right now I am Associate Professor in Gynecology at AMC Homeopathic Medical College, Belgavi. So today I am here to speak few words about PCOD, that is Polycystic Ovarian Disease, which is very commonly seen nowadays in young girls as well as in married women. So now what is this PCOD? That means polycystic means there are going to be n number of or many number of cyst formation into the ovaries. Now as you know that a female has got two ovaries, right and left. So that ovary will be studded with cyst. The cyst will be having some kind of a liquid content. And when this cyst grow to many numbers, the woman will experience irregularity in the cycles. So first thing what a female comes to us is the complaints of irregular cycles, that she may come and tell you that I'm not getting my periods regularly, or she may say that I'm getting my periods once in 2 months or 3 months, like that. That's the first symptom what we get. And then when the patients come to you in the late stages, so they may have some kind of a roughness of the skin. Now why does this PCOD develop? Is because of the androgens, that is called as the male hormones. Now the male hormone testosterone, when it starts popping up into a female system of the body, then it will suppress all the female hormones. Now the hormones of female like follicle stimulating hormone and the luteinizing hormone, when these hormones get affected, then there are going to be no egg release from the ovary. So that results into PCOD. It is nowadays called as moreover PCOS, Polycystic Ovarian Syndrome. Now why do we call this a syndrome? Because along with cyst formation, with irregular menstruation, there is going to be some kind of other metabolic disorders which start developing. Like example, the patient may experience insulin resistance that results into high glucose levels, then resulting into obesity. With all this kind of metabolic problems, the lady or the female or the girl can go into cardiovascular problems as well. So she may show in high in her blood pressure levels, and all these problems start happening. So that may result into not only your gynec problem along with metabolic disorders also. Then we get married women with PCOD coming to us with complaints of non-conception or there is no pregnancy happening in there. So that then we investigate the case, we see that she is having PCOD. So when there is no egg release, there is no question of that woman getting into pregnancy. So now what is the kind of a treatment what we have to give here is, we need to first see that the hormonal imbalance has to be taken care. So that the cyst, we take care of the cyst and then the egg has to be released. So depending on the patient what we get, you get a young girl who is not married, you start your treatment basically with you can say lifestyle management, with diet management and hormonal therapies to see that her ovaries are going to function well. In case of women with you can say who is eager to conceive, who is married for a long time and then she is eager to conceive, in such cases we have to go with hormonal therapies and we have to go with a kind of a medicine which helps egg release, egg stimulation what we call, and then when the egg is released, then I can say the patient has a chances of conception. So here we have to give some medicine for the ovulation induction what we call, and then we have to follow the patient with follicular study. So we have to call the patient every right from the 10th day of the cycle, and we call the patient every alternate days, and we do the scan of the pelvis and we study the follicles. So some patients respond well to the medicine, and then we see that the follicles are getting matured and then they get released, and many a time we get good results with conception in the pregnancy. Some females will not even respond to the induction remedies. Those women will have to go for other in vitro fertilization what we call, that is called as they can go for IUI, they can go for IVF, or they can go for gamete intrafallopian tube transfer called as the GIFT. So this kind of a management we have to follow the protocol. Apart from the treatment part, I would like to suggest the patient that they have to take care of their diet and their lifestyle and what is causing them the stress. They have to manage the stress well so that this kind of a condition doesn't pop up. Thank you so much.